This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. Let's walk through kind of postpartum nursing is such a niche, like as women's health is too. So like walk me through what a typical day looks like and like how you set up your day, like how many patients you have, all of that.
Yeah. So, my hospital, we are like the biggest birthing center in Wisconsin. We average, I think 2021, we had like 5,000 births in the entire year, which is wild. Wow. Last year we broke our record twice for the number of births in a month. So we're big. We have like a lot of high risk patients. So our ratios are 3 couplets to 1 nurse. So like 3 mom baby groups to a nurse. Sometimes we have NICU moms, that kind of depending on what's going on, but generally it's 3. Start my day, kind of getting organized like everyone does. We do still vitals and assessments on everyone, and not a ton of meds that we pass, usually just like ibuprofen and a stool softener, nothing too crazy. But a lot of what we do is education on taking care of a baby and like breastfeeding or however feeding they decide to do, doing like tasks and stuff, and like being like, sometimes like, especially on day shift, it's like being like a secretary, like this doctor wants to go in and this doctor wants to go in and the lactation wants to go in, but they also want a nap and like have to feed their baby. And it's just a lot going on.
How do you, what do the actual assessments look like? Like, what do you normally, what are you looking for?
So we do vitals on moms. Then it's kind of like more of a focus assessment. If they're like a C-section, we'll still do like heart and lung sounds, just to make sure everything's looking good. We'll do like the fundal check. That's probably the biggest difference.
How do you do a fundal check?
So the uterus, when someone is like fully pregnant, like 40 weeks or whatever, like it's all the way up under your like breast, like rib cage. And when you deliver, it shrinks back down, but it takes a while to shrink back down. So usually it's like right at the belly button. That's how you measure it. So it's kind of just like, sometimes gentle, depends on how like posterior it is, or, so it kind of just like a check to make sure that it's like firm where it's supposed to be. It's not like to the side, which could mean that their water's full. So yeah, we measure it based off of the umbilicus. So like one above would be like a centimeter above, 1 below. So.
Okay. And it's like like you feel for it essentially, like where the firmness is.
Yep. Yeah. And that was something that definitely took me a while to like learn, because like I said, I had no clinical experience with it. So it was just kind of just going out and like just touching everyone's stomach, and especially C-sections, like it can be painful. It's not comfortable for someone to like push into your stomach, but yeah, it's been something to learn.
That's really interesting, because I feel like there's not a whole lot of assessments nowadays that you really have to palpate for, other than like, I don't know, sometimes we'll palpate for like air, like up here, like subcutaneous air or something. But like most of the time it's like auscultate or imaging, or, it's like a very like skill driven like thing.
It's definitely something that takes time to learn.